We are live.
Namaskar. Welcome to this 69th episode of Gyan Pravah, a brainchild of our president, Dr. Sunita Tandulwadkar, madam. She is the president of Foxy for the year 2025, president-elect of ISAR 24 to 26, founder president, Society of Ovarian Rejuvenation 2023, President of POGS 21-22, Chairperson, Founder, Honorary Secretary, ISAR, Maharashtra, President IAG in 2019-20, Vice President West Zone Foxy 2015 to 17, elected board member ISGE 2013 to 17, reviewer and advisor, Journal of Human Reproductive Sciences, editor-in-chief, Indian Journal of Gyneic Endoscopy. She has authored 18 books and 85 publications. She is an invited faculty to 400 plus national and international conferences. She has a lot of awards, a few of which are the IVF Icon of the Year 2022, Pride of Foxy 2020, Bharat Gaurav Puraskar 2019, Best Medical Practice 2016 from the European Medical Association, Best Citizen of India Award 2016, Glory of India Award 2016, Punyashlok Ahilyabai Holkar Award 2015, Rashtriya Gaurav Award 2015. She also has a letter of appreciation from the President of India in the year 2012 and has the Sarvashri Award in the year 2012. Today, Madam is in another program and has not been able to join. In her stead, we have our dynamic Joint Secretary, Dr. Ashwini Kale ma'am, to take the program forward. Welcome, Dr. Ashwini.
Thank you so much, Asha Madam, for the kind introduction. Welcome, Mala Madam. It's always a pleasure to listen to you because you have been a very well-known teacher, and I myself have learned a lot from you in the last few years. So I'm damn sure that this is going to be a very interesting webinar, which is going to talk about scans and teaching. So basically, Foxy has started this unique series of Gyan Pravah, which is a podcast series wherein every chairperson has it every day at 8 p.m. sharp, a 45-minute crisp talk with an expert in their own field. So there are in all 30 chairpersons, and now this is the 69th episode, and it's going wonderful. So we basically send this link to all our Foxians and the general public also when the issue is pertinent to them. So basically, Foxy this year has got their two programs, which are Sampurna, which is on preconception care, where we want to create awareness among the common man regarding the importance of preconception care and how it is going to optimize the woman's health. The second the key initiative by Dr. Sunita Madam is Know Your Numbers, where four important parameters like hemoglobin, sugars, weight, and BP of the women is taken into account, and we are making a statistics out of it to actually find out which area or which women in the age group are at higher risk. And the third initiative is our Arogya Yog Yatra, where we are bringing spirituality in medicine. So we have covered three places till now, like Tirupati, Rishikesh, and Puri at Orissa. So we are planning to cover 10 more. So these are all the initiatives which are being taken forward by Foxy, apart from our other academic and social events. So I welcome you once again, and I would join from the general public's link to watch this interesting podcast. Thank you once again, Mala Madam and Asha Madam.
Thank
Ma'am,
you.
you're muted.
Thank you, Dr. Ashwini.
Thank you, Dr. Ashwini, for being with us and sparing the time. And also telling about the Foxy programs. Thank you so much. Now, I would like to introduce my speaker, my mentor in gynec ultrasound, Dr. Mala Sibbal ma'am. She is a consultant gynecologist, Department of Fetal Medicine and Obstetric Gynec Ultrasound at Manipal Hospital, Bangalore. She has authored the book Ultrasound in Gynecology, an Atlas and Guide, which was published by Springer in 2017. Post-director and faculty at Gynec Academy, where I learned under her for gynec ultrasound fetal medicine. She is an ISWAG board member, ISWAG trustee at present, ISWAG scientific committee member, international faculty member. She is an IOTA ambassador, has conducted 25 IOTA certification programs, published journal articles in JUM and UOG, and delivered over 500 guest lectures in 22 countries, including 64 cities at various international and national conferences. She stood first in gynecology and was the recipient of Best Outgoing Female Student Award, but she chose ultrasound. So that is going to be a very interesting part of her journey that we are going to explore today. So, ma'am, welcome to this podcast. Thank you for accepting my invitation. I'm really honored. And I would like to,
Thank you for that introduction, Dr. Asha, and I'm equally honored to be interviewed and to discuss, what I went through over the years with you and with others.
thank you, ma'am. So, could you tell us about a little about your early life? What actually made you the person you are today?
Um, that's very interesting, and very rarely do I get an opportunity to reflect back on this. But I think a huge portion of what I am today is thanks to my mother, as it is, I think, in many cases. She was a person who was driven by social service. And I remember when I was in the sixth grade, my father was dropping me to school by car. And seated next to him, I told him, Daddy, I think I'm going to stop studying now and I'm going to devote my life to social service. So he was very perplexed. And then he turned around and said, Beta, if you don't study, others will have to do social service so you can run your life or you can manage your life. And then it hit me that social service is not a job by itself, because you cannot support yourself. So then I asked him, what do you think is the best field then? What do you think I should study? And he said, I think medicine, because you can really serve people through medicine. And, looking back, I remember I had a doctor in our area called Dr. Chico. And he used to do amazing service. He used to serve 5 to 7 people who would pay him, and 7 to 9 at night, he would sit and look after, elderly people, people who didn't have money, chowkidars. And he was such a hot favorite, such a gentleman. He was such a role model for many of us. And he was a person who really inspired me to a great extent. To add to this, my aunt was a great biology teacher, and my other aunt, this is my dad's, Shashi auntie was, we used to live together, and she taught me biology, and she was an amazing teacher. And then I had an aunt who, my cousin brother, got into medicine, so she would make me wear the coat and tell me, see how this looks so amazing on you, just to inspire me further to do medicine. So I think, like the saying goes, it takes a village to raise a child. I think there's been inputs from numerous people for me to be driven towards medicine.
So, where was this? Which place?
I was in Bangalore, the city.
Even in your childhood?
Even in my childhood, yes. So
Okay.
it was Bangalore, yes. And yeah, I think that's what it is. A lot of people that inspired me to do medicine.
So, you chose medicine, but then why gynecology? And then why ultrasound?
Well, gynecology was, of course, I came first in gynecology. We had good teachers, but there were 3 fields that I was interested in. One was ophthalmology, one was internal medicine with the aim to do geriatrics, and third was gynecology. And for some reason, my father felt that, ophthalmology was a very small area of the human body. And he was very keen I do ophthalm. So, I do gynecology. So I thought, okay, since I like both of them. So I wrote them as choices in most of my exams. And as luck would have it, in all the 3 entrance exams I did, I got gynecology. So I think it's destiny.
Okay. So this is how you got into gynecology. You became the best female student. But then how did you actually land into ultrasound?
Well, ultrasound, I think, is the eye to the pelvis. I remember when I was a postgraduate in St. John's doing gynecology, an intern came up to me and said, we would do a pervaginal examination and say, this is a boggy field, this is firm. And imagine, is it a fibroid? Is it a mass in the ovary? And we really didn't know the answer. And trans-abdominal scans were very, very basic then. And she said, how I wish, the intern walked up to me. I remember her name, Lakshmi. I don't know where she is now. A very smart young girl. And she walked up to me. She said, I wish I had something at the tip of my finger that would help me see what that is. I'm just imagining. And I said, yes, I really wish. And it was right then that transvaginal scans came into existence. And I think I have a good sense of spatial orientation. I was very good in anatomy also. So I think when I began to see ultrasound, particularly thanks to my HOD and my mentor and dear friend, Dr. Preeti Venkatesh. She used to, I was a registrar under her, and she would do her scans and then she would operate. And the perfection with which she did that ultrasound was amazing. Even if there was one vessel somewhere, she'd say, what is this over here? And we'd think together. And when we'd operate, we would actually see it. And I realized you can see an amazing amount with ultrasound, and accurate diagnosis is the first step to right treatment. So I realized that, ultrasound was, I used to spend all my free time doing ultrasound. And later, as time moved, as we moved on, I realized it's very difficult to do everything in detail. So and I had another senior, Dr. Jaya, but I must be remembering all my seniors, who said, I think you're good at ultrasound. Maybe you should just focus on it. And I think that, plus the fact that I was good at it, and moment I made a right diagnosis, a lot of appreciation, and I was more confident in it. Then my husband used to travel, and I thought I could spend more time with my children. My parents were aging. So I thought it was a great balance doing something that I'm extremely fond of. And that's how I went into ultrasound.
I remember you told me you got the best student award, right? So to get a best student award, there has to be something in your life, that makes you strive to get it. That desire to excel or outstand. What exactly got you there?
I think this is something that I've been asked earlier. And I don't think personally, honestly, any achievement has given me the joy as much as doing the right thing. And that stems from my mother again. She never bothered what marks we got, but she always asked us, did you do your best? And that's all mattered. And I think success and happiness should come from the idea that I was fair on my patients who came to me with trust. When you teach someone, you should be fair on the time that they are spending listening to you. So I think the sense of justice, fairness, to realize that achievement is not what you require for happiness, but the fact that you did the right thing, that you were human. So my mother would never tell anybody I wrote a book or that my brother studied from this university. But if he did an act of kindness, that is something that she would really appreciate. So I don't think that coming first came from anything except doing my best. And I
Okay.
think that sense of satisfaction, even if we fail, if we've done our best, there's a different sense of thing compared to when we didn't do our best and we didn't succeed. So I think the idea that one should do one's best in whatever we are doing is what really drove me.
So that is what I got. Now you're the light. That is always wanting to do right, always wanting to do better. So, and that also in a humanitarian way. So I'm really glad I brought up this question. Now, you did ultrasound and you went on doing it for years. Then what actually made you turn to teaching?
Okay, teaching, interestingly, probably is a passion I have even more than medicine. So I used to teach right from school days, but more than that, when I started in medicine in the hostel, I used to conduct some classes for my juniors. I remember even the seniors would call me and say, when I was doing pharmacy and they were doing medicine, they would say, can you teach us about cardiac drugs? Can you teach us about drugs for diabetes? So I used to make notes, go into a room and teach. So I think teaching is a huge passion, and I like to teach anything. So when my daughter did law, I did civil procedure code with her. When she did business studies, I studied business studies with her. So seeing something complex, simplifying it, and then sharing that simplified understanding is something that I'm very passionate about. And I think I've told you this before, Dr. Asha, that I think if one is not super intelligent, it helps with teaching. because otherwise you sort of jump the steps in your brain. But I need to simplify everything. I'm not saying that I'm not intelligent, but being super intelligent, you tend to skip steps. And I could never do that. So I had to systematically understand everything. And I think that's what helped me with my teaching.
I remember we had a teacher when I was a first year student, not in medical college, BSc first year, because in our time we did 11th and then first year and went to medical college. So he was a PhD in physical chemistry, but we could not understand a single word of what he was teaching.
Very bright must be.
Yeah, maybe, but for us, he was useless. So what you are saying is exactly the reverse, or maybe giving an example that, doing it step by step makes it easier when you're teaching.
Yeah, and also I think teaching is the best way to learn. When you're teaching somebody, you have to completely understand and digest that, and then can you put it forth in your own words. So I think it's also shaped the amount I have learned.
Because I remember when I started gynec ultrasound, getting to know left and right, you know, I started from that when you put in the probe, you see the uterus right, but which is the left and which is the right. I think I learned from you from that step. To know the pathology is easy, but the spatial orientation, the relationship they have with each other, that is what I learned from you. And that was really incredible.
Thank
So
you.
that is how you went into teaching. Then how did that idea of Gyneic Academy come to your mind?
So that comes from, like I said, the fact that you get opportunities comes from a lot of mentors. One of them is Dr. Suresh from Chennai. He used to be very impressed, or maybe he really liked my teaching. So he would, I remember the first time I went internationally to Malaysia, it was thanks to him. He said, "No, Mala, you should come and give a talk on this." So I realized, that he was very happy with me. And one day at a conference, he said, "Mala, you should train individuals." I said, where I work, we don't have a proper training program. So he said, "Then you write a book." And I was like, I was for a minute perplexed. I remember telling him this word, "Sir, book." And he said, "Yes, because we must share with others what we have learned from our patients." So I took that very seriously. He said, "I launch it at Cusp." And this is a slightly long story, but it's interesting. So he said, "I will launch it at Cusp." And that was it. And then I wrote to Springer, and Springer agreed. I think Sir told me, "The only thing I want you to do is publish it with an international publisher." I said, "Okay." And then I sort of wrote my book, and I didn't even know. I was worried when I went back to Sir. Springer agreed to publish it. I thought he may say, "Which book did I tell you about it?" But he remembered, and he launched it at Cusp. And it was such a chance that Professor Lil Valentine, who is my mentor and role model for many things, was the chief guest then, and she was the person, the invited, guest at the book launch. So she, launched the book and opened it, and she told me, "Can I read this book? Can I take it?" It was a rough copy. I said, "Sure, Professor." And she took the book and went to her hotel. Next day, she didn't come because she didn't have a talk, but she gave me a call in the evening and said, "I'd like to meet you." So I went there, and then she asked me, "How did you write the book?" So I took all my hard drives. I told her how I followed up my patients, gave her all the details. And then she said, "Maybe I'd like to have the soft copy." And I said, "I'll check with Springer." Springer said, "Yeah, if she can give us a review, that would be great." She said, "Sure, I will." And she left. And I had written this book not knowing whether a single person in this world would ever read the book. So I just wrote the book, and I was working on myself. And I remember at 1 at night, one day I was working on some slides, and a mail popped up from Professor Lil. That was a month after the launch. And she said, "Mala, oh Mala, I forgot. I had typed this mail, but I forgot to send it to you." And it was a mail appreciating my book. And she has written a second foreword to the book. And it's the first time I broke down, because I had no idea that it was worth a single human being reading it. And then I realized what I wrote was really worth it. And I think her words made a huge impact on me. And then I learned very well through online teaching. There was a CD that was from UK London, from the FMF, where Dr. I think his name was Ian. I think he's no more. He passed away when he was pretty young, but he had a CD on fetal echo. And I remember me and Dr. Preeti and Dr. Tangam, we sat down and we learned, we rewound, there were quizzes at the end. And I thought that was the best way of learning, because in a conference, after certain minutes, you get distracted. And if you lose concentration, you lose the follow-up. And that used to be very disturbing. So I realized this was the best way to learn. And so I said, maybe if my book was good, an online course would also be something that would help people and would be, of interest to me. So that's how the academy started. Of course, we started in very small numbers, and the first few years was a struggle. But now we have doctors from 57 countries, and it's been a real pleasure going through this journey to where we are today.
So, you have students like me who are so, means who've been in practice for so long, they have certain hardcore, ideas which may not be correct. And then you have the youngsters who come who are planning to take this. And then there is the, different countries, different cultures. How do you actually balance all this?
I think the first thing to realize is that the anatomy and pathology is the same all over. The second thing is to realize that people who actually come in are already people who want to learn. They don't come in with this ego that they already know a lot. So that itself makes a difference. And thirdly, I think deep down, I honestly have the humility, and I know I may be good in gynae ultrasound. There may be many others good, but those who come are already very well versed. Some people are doing amazing fetal medicine. Some people are doing laparoscopies. Some people are doing robotic surgery. So it's not like I'm above them. I know a certain amount that they wish to learn from me. And there is so much more that I have learned from others. So I think once you realize that we are all together in this, there's a lot of sharing, there's a lot of learning, may not just be academic, maybe non-academic learning. I think it's great growing together. I don't think it's been a challenge. Neither has age, nor has race, nor has religion, nor has country ever been a challenge, because we all have come together to do our best for the women we can.
Agreed. That is a very beautiful thought. How did you get into IOTA? You're an IOTA ambassador. You came to Raipur as the IOTA ambassador. I was one of the students. I had helped arrange that program. So,
Yes.
how did it happen?
Yeah, so, after I wrote the book, I was surprised. I think in 2000, I don't know, 11 maybe, I don't remember, many years back, G invited me for a gynae focus group in Paris, where everybody was to meet and see how we can promote gynae ultrasound all over the world. So I was to show give data from Asia. Where is gynae ultrasound today? What are the prospects? So I interviewed a lot of people, got some information. And there, I remember Professor Lil was there, Dirk Timmerman was there, Tom Bone was there. There were many others who are the IOTA, core committee members. And Professor Lil just told me, Mala, I think you need to, actually do the IOTA teaching, because we had already done a few together. I mean, she had heard me. I had like some part, Antonia did, some part I did. So they knew that I think she knew that my material was correct. So she said, I think you should, start teaching IOTA, because it's not possible for us to reach everywhere. So she said, you should cover Asia. There's a huge amount of work to be done. And she just walked up to Dirk and Tom and she said, I want Mala to do this. And they said, sure, if you tell us, that's it. So that's how I became an IOTA ambassador. And since I love teaching, and IOTA especially inspired me a lot, because it really shortens the learning curve for diagnosing adnexal masses. And there's a huge difference between physiological masses, benign masses, and malignant masses. And I've actually lost a second cousin to a wrong diagnosis of an ovarian mass, and she left behind her 8-year-old child. And I think it's not really fair on our patients to say that, I don't know what this mass is because I'm a beginner. IOTA has come up with this they have really worked hard, and kudos to the IOTA committee. I'm really extremely grateful because a lot of us can quickly make a diagnosis whether this mass is likely to be malignant. And if it's malignant, this patient can receive treatment. The problem is pre-operative evaluation of ovarian masses was very often by RMI, by other modalities that pick up 75% approximately, but they pick up the advanced 75%. Whereas with the IOTA methodology, you can pick up early cases, which will help save lives. So I think that's where IOTA has come up with an objective way in which we can quickly make a diagnosis whether a mass is likely to be malignant or benign with high accuracy. And I think the fact that I feel that one course can really help. If we speak to 100 people, those 100 people may scan maybe 10 people with adnexal masses, so 1,000 women will benefit. So I think the in my brain, I felt that this is a very quick way of reaching out and making a difference in the lives of our women.
Losing your second cousin had something to do with it? Or
No, I think that added to my drive to really explain, simplify, and ensure that people. In fact, I read up after that, and it said one of the only known causes for depression worldwide is not, they're talking about circumstances and genes. And the only thing that there was a study, I think it was based out of Canada, where they said that losing a mother before the age of 18 has the highest impact and makes a difference when it comes to depression later in life. It's not like others are not important, but this is something that they statistically analyzed in individuals. And I think when women come to us if we miss a diagnosis, we are actually ruining that family. And I think we owe it to our society or to our patients who come to us with so much trust to be able to live up to their expectations, to their trust.
so, you already had that book in hand. You had been collecting your cases, following them up. So basically, without putting a title to it, you were into research. And that is how, yeah,
Yes.
what is research? You are basically trying to put things together. Does this correlate? What is the follow-up of this case? You were doing research. So how important do you think? Now you have international publications, many of them, and that internationally published book. So I'm just asking you, how important do you think research is to the people who are working today?
I, I think as a young doctor, I did not realize the importance of research. I have a classmate, Dr. Harshad, who is a gastroenterologist, and he met me at a medical college, our get together, and he said, Mala, what have you published? And I hadn't published much then. And he said, why aren't you publishing? And I thought publishing is like you just write. And he was so disappointed in me. He said, you were such a good student. I came second in the final exam. He came third. He was so disappointed that I had not published. That it made me feel as if that's something I was supposed to do. And he was a great inspiration that drove me into writing and into publishing. But what you say is right. Why I began to follow up my patients is there was no literature some years back. So what would happen? You'd see a case and then you'd be worried what it is. You follow up the case and you say, oh, this is a dysgerminoma. Okay, this is a mucinous borderline tumor. And the next time you see a case, there is a pattern recognition in your brain, a subjective way of evaluating, and you'd say, oh, this is what it is. So how it all started was there's a Dr. Tamil Selvi in Salem. She called me to do an IOTA. She said, it was before IOTA, before everything. She said, can you teach us about adnexal masses? So I had followed up a lot of my patients, but I had not put my data together. So she gave me 6 months window notice, and I sat down seriously and looked at, I had it, but they were all like in bits and pieces. So I put it together and prepared a talk. And later she told me she gave me this talk because when we were doing ultrasound training, she said, you used to teach us, and I don't even remember that. And you were such a fascinating teacher that I thought you should come and teach us adnexal and masses. And I realized there was so much information in those cases that I had followed up that I was confidently able to speak about it. So my journey into gynae ultrasound, I think, primarily started from Dr. Tamil Selvi. I used to do fetal medicine and gynae, but then this sudden passion for gynae ultrasound, because there was this, you know, great, like I began seeing and understanding gynae ultrasound, which was not available in literature. So I was very, very drawn by gynae ultrasound.
Okay. You remember you started out with that student of yours who said that, I wish I had something at the tip of my fingers. If you could just dilate on that statement, because after I learned gynec ultrasound from you, that's what I feel as though, my eyes have extended into the pelvis. So something that will lead the way for others who have still not started.
Yeah, so I think doctors who are doing ultrasound anyways, or and don't do a lot of gynae ultrasound, or gynecologists who are seeing their patients. I think in large areas of the world today, clinicians do their own ultrasound. And I think that makes a lot of sense, because a patient comes to us and we are not able to treat because she has to go back, take an appointment with a sonologist, has to get the report, come back to us on another day. So she loses 2 or 3 days of work. Plus, she is going to continue to suffer until that time. There is a delay. She may be traveling. There are so many issues. So it becomes so simple. And I think you don't have to be an expert right away, but able to be distinguished between what is normal and not normal. And over a period of time, if you follow up your cases, you operate your cases, you will automatically become experts. And today there are numerous ways of learning. There are books, there are journal articles, there's ISWOG you can join. There are so many online courses, on-site courses. So there are numerous ways of learning. And I think it will really benefit our patients. I mean, if I was a patient, I'd love to go to a doctor. She asks me what my problem is. She examines me, does a scan, says, this is your diagnosis and this is your treatment. I just love that. Not only that, I think every gynecologist in time will have to learn ultrasound, because today guided procedures have become very essential. They are safe, they are simpler, there's less complication. So whether it is inserting an IUCD, whether it's doing hysteroscopic resection of a septum, whether it is doing and ultrasound guided sclerotherapy for an ACUM. No matter, there are numerous procedures, and no gynecologist with time, I think nobody would want to venture blind into the uterus, not knowing what we are doing. It's very, very easy to have a probe, and a lot of people do teamwork. So one person is holding the probe, the other one is doing the surgery. In Fernandez Hospital, for example, they're a team of 2 or 3 doctors. They together do ultrasound, clinical work, and a surgery, and they've teamed up together. And it's an amazing work of doing great service to our patients. So I think it's not a skill that you have a choice with. With going forward with time, it will become an absolutely essential part of clinical work.
Okay. So how long have you been doing just ultrasound?
From 2002, 23 years.
23 years. So what keeps you passionate about it to this day? Otherwise, what happens? Everybody get up, see patients, come back, relax. It's like that. What keeps you so passionate about it still?
Well, I think my knowledge has increased over time, and the fact that I know that there is more and more literature coming out. So what happens is, usually at nights I read a little bit of something new that has come up, and then there are some things that you were aware of, some things that you've learned, and always the drive that if there is some information there and I don't know, I cannot give my patient the best. So that drive to know, and a lot of times I actually tell my patients, I don't know what this is, I have not seen what this is, but I will read up or I will speak to other colleagues. So I speak to my other friends. It could be Dr. Ladbans in Chandigarh, who's a radiologist. Maybe there's a pelvic mass, I don't know. There's Dr. Preeti. There are, Professor Lil. I've sent her images also. And and then you go and read up literature and you say, oh, there's something like this that has been reported earlier. So I think the fact that you want to, I think that basically it stems from what my mother told me. You have to be just and fair. And to be fair to a patient, you have to do your best. And to do your best, you have to scan meticulously and you have to learn continuously.
You know, you've been practicing for so long. Now, if you could meet your younger Mala, the one who just stepped into medical college, is there any advice that you would like to give her that would make her life easier?
Research. I didn't do enough research. I followed up my patients, but I didn't publish, I didn't share. And I think India as a country, we lag in doing research because research is not mandatory for us to go up the ladder, whether it is in universities. But I think we have such massive amount of cases. We can produce amazing research. And there's one thing I think that's where I think I lacked, that I did not do research enough in my younger years. I wish I had done and I had published more, but other than that, I don't think I would like to change anything. But when it comes to, others, I feel one thing I want to tell them is research should, when you're doing research, there are two things that you should keep in mind. One is never do research just to say, yes, this study done elsewhere, I can say that this is how it applies in India. You can get creative, you can come up with your own things. It doesn't have to be something you have to follow. And just because you're from a country which is not right on top, maybe academically or socioeconomically, or for various reasons we've not been publishing, don't belittle what you have seen. If you have seen something, like we would discuss it, and if you have a good atmosphere at workplace, like fortunately I have, I think you should team up and say, what is this, why do we see this, like the follicular ring sign in torsion. I used to wonder what it is. Then I spoke to Dr. Preeti and a few other friends. They also saw it, and then you sort of feel confident. So I think you should share what you observe and not be afraid that you may be wrong or that you may not do it right. So that is one thing. And secondly, something I observed from Professor Antonia Testa is the way she does research is with the idea that tomorrow it will change the way we practice. Tomorrow it will help a patient. For example, she did a study on adnexal masses in pregnancy, and she analyzed if it's multilocular solid, these are the outcomes. So this is how I will counsel my patients. I'll tell them 80% chance that it is malignant. So what should be the way I counsel? And based on that, what would the outcomes be? So the way she did research is fascinating. If you read that article, and tomorrow you see a patient who comes with an adnexal mass in pregnancy, you can actually advise them or counsel them appropriately. I think that is something you should keep in mind, that is this research. You should, of course, even if it's you think it won't make a difference, you can still discuss it, share it, publish it. But remember, try and get information in a manner that will change the way practice goes going forward. I think keeping that in mind will really make very powerful research, coming from us. And I think in India we have numerous number of patients, and I think just keeping some time away for research in a week will make a big difference in our lives and in the lives of our patients. And also we can share it and better, literature in this field.
You know, every year there are so many gynecologists, students taking up gynecology, each one getting allotted research topics for their thesis. Any advice on that? What should be the content of those? Because what is happening, as you said, those Me Too articles, something published, you alter it or try to compare it with what you're seeing. But it's not actual research.
I
So
think
we
there
have, I don't know how many students in gynecology all in the country every year. So any tip on how they should be choosing their topics?
So I am now in a phase where I'm very excited about research. So I have met a few professors in universities and I've spoken to them about this. I remember I spoke to a radiology professor in Banaras Hindu University and a few other places in Lucknow. They said we have massive number of cases. Our anomaly scan is got a wait list of 2 months. So they said we have so much work that we are not able to devote time to research, proper research from our postgraduates. So I don't know how the system can change, but I think as professors, as junior, assistant professors, as lecturers, I think these are the people who can make a difference. Because if you tell your student, it's not important what research you did, but did you do 40 scans today? That student will never be inspired to do research. So I think, in fact, recently at the Karnataka, we have the Musk Association, Medical Ultrasound Society of Karnataka, and we had a discussion about what to do on the website. And I thought there should be a corner of appreciation for people who do research. We don't recognize research, we don't appreciate research, we don't share our knowledge, and it's really not okay. So I think as seniors, more than telling juniors what they should do, I think as seniors, we need to appreciate research from individuals. We need to tell students, if you're doing research, just don't do it as a job to be done, but think of something fascinating. Think of something that will change the practice. And you can go after your professor, even if your professor is not that oriented, you can tell them, do you think I can do this? So when they see interest in you, they're more likely to support you in your research. So I think there's a lot of scope in India, and I think it's both in the hands of the professors, maybe more, and also to some extent in junior doctors. Because if every postgraduate, like you says, does some good research, and we have numerous cases, just put in those few extra hours, I think we will have huge amount of literature from India that will benefit women in the world.
Thank you, Dr. Mala. So, how do you see this training in ultrasound, whether it is fetal or whether it is gynec ultrasound? The physical teachings, the online teachings, where do you see the future taking us?
So, so when it comes to teaching ultrasound, I don't think our postgraduate courses in radiology or in gynecology are very focused on teaching gynae ultrasound and fetal medicine. So that's why we have a lot of centers all over. Teaching basic ultrasound, how you move the probe, is something you probably will learn nowadays in all postgraduate courses. So nowadays, almost every university, they do some basic ultrasound, and I think that part is now simple. So I'm not very, I don't think these, like learning how to turn your probe for juniors, youngsters is a big thing. They've learned it while they're doing their postgraduate. But the thing is doing actual training. So there are two ways of doing it. One is on-site and one is online. On-site has an advantage, particularly if you're doing procedures, if you're doing, maybe you have to do some amount of on-site training. But today I feel it is impossible. Even if a person stays with me for 6 months to learn gynae ultrasound, they may not see the variety of dysgerminomas I've seen. They may not see the immature teratomas, because I, in my so many years, have seen 2 immature teratomas. So how can that person see everything? There has to be learning beyond on-site learning. So I think online learning is really great, because you see what somebody has seen over years. You pick out your cream cases, you pick out your rare cases and put it all together for teaching. So that is something. So I think online training is great, but I think in fetal medicine, particularly when you're doing procedures, on-site fellowship programs are great. And the third thing I feel is there has to be continued learning. So continued learning can come from an online, like in Gynecology Academy, they have regular webinars, we have regular WhatsApp group, and there's a continued learning where Dr. Ramurthy will actually look at those WhatsApp group images, comment on it, help. So it's a great learning. Or you can go to ISWAG, for example. ISWAG has multiple programs. You have, every now and then there's an interesting research article that comes out. So I think, we can't get complacent about the fact that we know. One is to learn well, and then is to continue learning. So as of now, basics are well done in postgraduate courses. Learning in depth can be done on-site and online, and they have their pros and cons. I think online is very great because on-site cannot cover, but then there are some things on-site that are also essential. And continued learning can come from ISWAG, it can come from conferences, it can come from online programs that have these facilities for regular learning. So, and there are now numerous online webinars, so you can attend them and keep your knowledge updated. That's what we all do. I also attend, and I also pay for courses, and I also attend, and I also learn.
That's great, because that feeling that I have achieved, I have learned everything, is the biggest killer, I feel. There is more to learn. Every case teaches you something new. And the thrill of seeing it, diagnosing it, and then seeing it actually when we are operating on it, it's something else. It gives a different high. So, we are nearing the end of our session, and I would like to ask you, what final message do you want to give after so many years as a gynecologist, as an ultrasound practitioner, and now a teacher, an ambassador, a person writing books, and now, focused on research? What is the final message that you would like to give to young gynecologists and to seniors as well, those who are practicing?
Well, to seniors, I'll keep it brief. I think those who have a thirst for knowledge will continue to learn. But I think if you're a clinician in particular, don't accept reports that are suboptimal. Have the courage to go up to your sonologist and tell them this was wrong, your diagnosis was wrong. I still have colleagues of mine who will come and say, hey, Mala, this was right, or this turned out to be a sarcoma, and I thought it was a fibroid. So I think as seniors, it's very important to be able to, there's nothing wrong in telling somebody that you've gone wrong, because they can only learn then. And as seniors also, I think you should encourage research with your juniors. That's something I would tell seniors. And when it comes to juniors, first of all, I think don't remember, success, happiness doesn't come from achieving a title. All titles are short-lived, they're temporary, they don't last a lifetime. You don't sleep in peace with a title, but you sleep in peace when you know you've done the right thing. So do your best, no matter what it is, whether it's whatever job you're doing. In fact, honestly, we can learn not only medicine, we can learn good English from other speakers. We can learn good, I've learned like how people deal with other people, leadership skills. So much we can learn from others. So the other thing is keep learning. Professor Lil came to Gainoa. She's probably one of the world's best, and she completed an entire book of notes from other speakers. So that thirst for knowledge, I think that should always be there. Humility is very important, whether it is from our patients or it is our colleagues, because we must acknowledge we are not all in all, like you said, supreme. There are numerous people who may be better than us, even in our field, and definitely in many other ways, they're better than us. So keep doing your best, put in some effort for research, follow up your patients, and be very happy if you've done the right thing. That's all that matters.
Thank you so much. Thank you so much for those final words. So I think we can end the session here. It has been I gave that title, Lighting the Way, for better scans and better teaching. And I think you've really done justice to the topic. It's been great talking to you, a great honor, and also a great learning. What you have said at the end is, don't let the student in you die. Let that student live and live on. Thank you so much, Dr. Mali.
Thanks,
Namaskar.
Dr. Asha. Thank you very much for the opportunity. Thank you.